Hello, my name is Cindy Abear, and I am a DNP student at Jacksonville State University, and I will be performing an assessment on you today. Before I begin, I would use proper hand hygiene and use gloves when necessary. Can you tell me your name and date of birth?
Ashley Morrow is 12/22/93.
Okay. Can you tell me today's date?
December 3rd, 2022.
Okay, so what brings you into the office today?
I'm new to the area and I haven't had a physical in a while, and I just need a good checkup and to get established with a new doctor.
Okay, good. So for my general survey, the patient is alert and oriented times 4. She is well kept and groomed, and she has normal posture. So we will begin with a full physical assessment. Before that, I'll have to get a detailed medical history.
Okay.
Are you allergic to any medications that you know of?
Yeah, I'm allergic to Bactrim.
Okay. What happens when you take Bactrim?
I have swelling of the tongue and mouth, and I get a rash as well.
Okay. So that's a severe reaction. We'll put that in your chart. Are you allergic to any food or environmental allergies?
No.
Okay. Do you have any cultural or religious beliefs that I should be aware of?
No.
Okay. So next, do you take any medicines every day?
No, ma'am. I take just ibuprofen for a headache occasionally.
Okay. How much ibuprofen do you take when you need it?
Maybe like 200 milligrams, and maybe like every other week, just
Okay.
when I get a migraine.
Okay, that sounds good. Do you have a detailed medical history?
I really don't have a history. I was tested once for sleep apnea, and they said I had it.
Okay. Do you use your CPAP?
No.
Okay. So we'll make sure to get a follow-up with your ENT, because if you don't use your CPAP and you do have sleep apnea, that can cause health issues later on. So it's really important to use that. Have you had any surgeries?
I had my wisdom teeth out.
Okay. Have you ever had to stay overnight in the hospital?
No.
Okay. Can you tell me your family's medical history?
Yeah, my mother's 56. She really doesn't have any health problems other than just diabetes type 2.
Okay. And your father?
He's 57. He has high cholesterol and then just borderline high blood pressure, but he doesn't take any medicine for it.
Okay. Do you have any siblings?
Yes, I have one sister. She's 26 and she doesn't have any problems.
What about your grandparents? Are they still alive?
No, they've already passed.
Okay. I'm sorry to hear that about them. What do you do for work, Ashley?
I'm a nurse in an ER.
Oh, that's great. So you work typically 12-hour shifts?
I do.
Okay. Do you exercise regularly?
Yeah, I try to exercise like 3 times a week maybe.
Okay.
I walk on the treadmill for about 30 minutes to an hour.
Okay, that's good. Are you married?
Yeah, I've been married for 5 years.
Okay, good. Do you smoke or do drugs?
No.
Okay. Do
Never.
you drink alcohol at all?
Maybe like once a month.
Okay, just socially maybe?
Yeah.
Okay. All right, so next we'll move on to the physical assessment. We'll start in a head-to-toe fashion. We'll start with her head. Again, the hair appears soft. There's no coarseness or brittleness. Her head is symmetric. There's no visible lesions or scars. Her trachea is midline. There's no abnormal goiter or swelling in her neck region. We'll start with that. We'll start with her eyes. I would use an otoscope if I had one, but for now we'll use a pen light. Okay. Follow the light. Good. Okay, so her pupils are equal, round, reactive to light, and they accommodate. They're 3. So we'll do that. And if we had it, we would use a chart or a newspaper to assess her visual acuity. Next, we'll move on to her ears. If I had an otoscope, I would use that to assess the inner and middle ear, but we will just assess the outer ear, and there's no drainage. The ears are symmetric on both sides. Okay. Next, we'll look at her nose. There's no drainage in her nose, and we will palpate her sinuses for tenderness. Are they tender at all?
Mm-hmm.
Okay. All right, that's normal. So next we'll inspect her mouth. If you can say "aw." Her oral mucosa is pink and moist. Do you see a dentist?
Yes, twice a year.
Okay, good. Also, do you see an eye doctor at all for your vision?
I do.
Okay, good. Next, we'll check her jaw and just make sure there's no clicking if you'll open and close your mouth. Good. And no pain. Next, we'll move on and assess her lymph nodes. So we'll palpate those. I'm just going to push and we'll feel for any tenderness or movable nodes. And there's several regions that we're going to be checking, just feeling for any abnormal lymph nodes. Okay, and there are no abnormalities there. So next we would be moving on to your thoracic exam.
Okay.
So we can tell that there is no use of accessory muscles. Her breathing is unlabored, and there's normal chest wall expansion. We're inspecting the chest, and there's no abnormalities. So next we'll move on to percussing and tactile fremitus. So I'm going to just feel the vibration when you say the word 99.
Okay. 99. 99. 99. 99. 99. 99.
Good. Okay. And that's normal. And then we will percuss her lungs and just listen for tympani over her lung bases. And we will do this anteriorly as well. And then next we will auscultate all her lung sounds. And we will listen for a full breath cycle. Okay, and then we'll listen on the back. Okay, and her lung sounds are clear bilaterally. There's no abnormalities in her breathing. It's not shallow or labored. So next we will move on to her heart assessment. So with that, we can listen to her carotids and see if there's a bruit. And we'll start by that. I'm just going to listen on each side. Okay, and there's no bruit. I'm going to feel your carotid pulses. One at each time. And they are 2+. Next, we would palpate for thrills, and there's no thrills, and we would look for abnormal pulsations. And then we would listen to the areas of her heart, the aortic, pulmonic, tricuspid, and mitral. So we'll listen with the bell and diaphragm of our stethoscope. We'll listen with the bell. Okay, and she has normal S1 and 2. There is no murmur or gallop. That's noted. We will assess her pulses. Distally, her radial pulses are 2+. We will check cap refill. and it is less than 3 seconds on both hands bilaterally, and then we will move to her lower extremities. And we will check her dorsalis pedis on both feet, and it is 2+ bilaterally. And then her posterior tibial, 2+ bilaterally. And then we can tell in her lower extremities that there is normal color. Her cap refill is less than 3 seconds. There's no evidence of peripheral vascular disease or arterial disease by the color and hair on her lower extremities. Okay, so that completes your thoracic and cardiac examination. We'll move on to your abdomen. So I'll have you lay back a little bit for me. And if it's okay with you, we can expose your abdomen. First, we will inspect. I'm going to lower this for you. Her abdomen is rounded and symmetric. Her umbilicus is midline. Next, we will auscultate in all 4 quadrants. Vowel sounds are present in all 4 quadrants. Next, we'll listen with the bell of our stethoscope to her abdominal aorta for a brewery. Okay, I'm sorry. Okay, there's no breathe heard in her abdominal aorta. So next, we will percuss your abdomen, and this is just the tapping again. And we should hear dullness over the liver and spleen, and resonance over the stomach. Tympany over the stomach. Next, we'll start with light palpation. And this is just looking for any tenderness or guarding. And then we will follow that with deep palpation, and this is just feeling for any masses. Okay, and her abdominal assessment is normal, within normal limits. We'll have you sit up. And then next, we'll move on to your range of motion and musculoskeletal. We'll start with your upper extremities. We'll start with your shoulder, so we'll palpate the shoulder, inspect it, look for any tenderness or redness, and we will do both shoulders. Okay, and then I will test her range of motion if you can lift your arm up, and then try to touch your other shoulder. And the same with the other arm. So range of motion in her shoulders is normal. And then next we will check her elbows. And then if you could flex and move your elbow for me. Good. And we'll check this one for any redness or swelling. Range of motion in her elbows is equal bilaterally. We'll check her wrists. Okay, you can do range of motion of your wrist for me. Good. And then we would also check her spine if you can stand with me. And then if you can turn. And then try to touch side to side. Okay, the patient has full range of motion of her spine. You can sit down. To check her hips, we would have her lay on her stomach and lift each leg to check the range of motion of her hips. And then we can also have her take her legs out to check. We will check her knees. There's no swelling or tenderness or redness in her knees equal. And then we will do range of motion in her knees if you will just move them for me. Good. And then we'll also do her ankles. And then full range of motion in the ankles. Good. And no abnormalities in her range of motion. Next, we will assess your gait. If you could take a small walk for me. And we're just looking for any swaying or abnormality in her walk. Walk on your side. Okay, and do another one. Okay, good. And if you'll come back here with me, we'll test the raw